Welcome everybody. We have Two Cents Tuesday. This is the Who's Badass Kids Are Those podcast with your host, me, Dr. Jarret. We have a special guest in studio today, and I will be introducing him off the bat. But I wanted to just welcome everybody into the program, into the show. And as you know, we continue to bring you new updates and new things that are going on, both for your health and your child's sake and the sake of their behavior. So I'm Dr. Jarret. I'm your board certified pediatrician and behavioral expert here to help parents get better control, better behavior out of their kids. And we do it through many ways. But my most favorite way of doing this is really interacting with you guys live in Two Cents Tuesday. We've been running this show for a few years now, and it's just one of the most favorite things I get to do. And we've been having updates time and time again. We've been having them come on more frequently now because of the COVID pandemic that we're in. And of course, I want to bring you guys nationally recognized experts to this show to get your questions answered, as we have today with Dr. Bob Motley. We have Dr. Bob Motley here on the program today to be with us. Not only is he a family physician, not only is he a physician executive and administrator, not only has he had many things published in the literature, had many leadership roles, he is currently the vice chair of community medicine at Jefferson Health System and Jefferson University and all of the Jefferson campuses in the Philadelphia region area. And any of those watching in the Philly area, Bob and Dr. Motley is also born and raised in the Philly area. So he's about as Philadelphia as you can get. So I would love to welcome you to the show, Dr. Motley. Thanks for coming on Two Cents Tuesday with me.
Hey, glad to be here with you, Dr. Jarret.
This is some great stuff. So as you are giving yourself a short bit of introduction, I would like to hear a little bit about what's going on in the Philadelphia region as far as COVID preparations and the things that you have going on at Jefferson.
Yeah, so I'll start just with a little background. I grew up in North Philadelphia, went to all local schools, and then ended up going to Jefferson for medical school. Over the course of 30 years, have had a lot of other places where I've had the pleasure of working in Bucks County, up in the Lehigh Valley, where we happen to have met a few years back. And then amazingly, an opportunity came back to follow one of my mentors, who was in a phased retirement at Jefferson. So I started back there a couple of summers ago. My role there is both as a clinician, so I do see patients. I also work with some of our med students, but I think the most meaningful work I get to do is working with our community agencies and the public health department and a number of collaborators to try to improve the conditions of health. As a clinician, a lot of us see people who come in and they're trying their best to try to take care of themselves, and maybe they're working with diabetes, or they're trying to lose weight, or they've got high blood pressure, or they're feeling overly stressed. And it's hard to work on your game if you lack material needs. So, sadly, Pennsylvania does have a poverty rate that's about 30%. And, if you don't have food on the table and you're worried about paying your utility bills and your rent, it's hard to focus on yourself when you've got a lot of noise. So I think we have a really wonderful network of people within our neighborhoods, community agencies, community development corporations, faith-based organizations, people who really want to help and help us live better. And I think within healthcare, we sort of form a bridge, if you will, from the clinical world to try to help practicing clinicians understand many of the barriers, but also the aspirations of the patients in front of them, and try to connect them to maybe the resources that can help support patients so they can do the work of being a patient. It is hard work, and at the same time, we're all aligned in wanting them to live better and live more healthfully.
Well, that's an awesome mission, and I know it's a great city to be doing that kind of work because you're able to help a lot of people at a lot of time, and a lot of people, as you mentioned, that may not have the resources for a lot of things. As many of you guys across the country are noticing that as your schools are changing a little bit, they're changing from offline to online programming. They're also trying to make sure that they're delivering meals to the kids and allowing breakfast and lunch to continue, even though the kids aren't actively in school, knowing that some of those basic necessities are needed, and they're needed by children in virtually every school system across the country. So the fact that we're still trying to take care of people and make sure they're getting some of the basics is kind of step one to dealing with this pandemic. Because if you're not getting the proper food, clothing, and shelter, you can't get to yourself to really wrap your head around social distancing, some of these other things that we're asking people to do, staying away from 6 feet, staying at home, staying away from crowds, and all the things that have become our reality right now. I would like to welcome all of you guys watching live on Facebook. We have Ben, we have Rhonda, we have Cindy, we have Demary, we have Melissa. All of you guys, thanks for tuning in to Two Cents Tuesday live on Facebook. This is the Who's Badass Kids Are Those podcast with me, Dr. Jarret, your host. Today we are with the Vice Chairman of Community Medicine at Jefferson Hospital, Jefferson University, Dr. Bob Motley, and we are switching our focus to talk a little bit about the COVID pandemic and what it's mean. And many of you guys who have been watching over the past several weeks, you guys know that we've been talking about lots of different things. We've been trying to break the news here on the early side to get you prepared for what you may be doing, particularly for those of you in different communities, maybe at different stages of isolation or lockdown, or staying at home and quarantining, which hopefully the vast majority of you guys are doing right now. But some of the basics still remain the same. We want you to remain socially distant from each other. We've talked about not throwing the parties, we've not throwing the neighborhood barbecues, not having the get-togethers that we're so used to having as social beings, which becomes difficult with times. But we want you guys to remain safe, and I hope you're doing so. And one of the questions that has been brought up by multiple of my viewers, Dr. Motley, so one of them is about masks. We had Dave, one of our viewers from last week. Dave, and I don't know if you're out watching today, Dave, but I hope you are, because I know we talked a little bit about this subject last week. We have a lot more to share with you guys this week. And I want to also acknowledge Ben from Pennsylvania. He also was curious about this subject matter too. So we will be bringing this episode to you guys right now. And I want to talk about masks, Dr. Motley, because one of the things that has really come to the forefront in between last week's episode of Two Cents Tuesday and this week's episode is the asking of the experts about masks. So could you tell us a little bit about masks and how they can help us?
Sure. Yeah, you could see with so many aspects of the COVID pandemic how rapidly things are evolving. We went from, try to just not go outside too much, and then we went to, well, maybe you should hunker down at home. Philadelphia, where I come from, is living a little bit in the face of the shadow of New York City. But we also have had a rapid uptick in Pennsylvania, and we're probably a week or so away from a peak in our own city here. So the coronavirus is just incredibly contagious. That's what we've learned. And we've also learned that maybe even like 3 or 4 weeks ago, where we thought only 1% of people without symptoms could be shedding virus, that number is probably a lot higher. The virus is actually carried in water droplet and spray that might come from a sneeze or from the nasal secretions. And because of the high degree of infectivity, obviously healthcare workers are encouraged to use a mask. I think the rub comes from, so what's a good mask and what's going to work? Because the coronavirus particle size is so darn small. Now, there's been some good work done both at Stanford and also in the commercial space in terms of what materials might work best. And so you've probably seen or read about everything from an N95 mask, which traps 95% of fine particles. But because of the shortage in supply, most surgical masks, yep, there you go, you got your N95. Most of them are being reserved for healthcare workers in the hospital taking care of sick patients. And there's still now, I think, less. I don't think folks realize just how quickly you can shoot through these when you're seeing a number of patients in the course of a day. So there's been protocols for reusing those masks within a hospital setting, and maybe even covering them with a surgical mask, which could be tossed by a healthcare worker. If you're not in a hospital setting, you're not fortunate enough to have a surgical mask, that material, which is called SMS, it's actually a pressed fabric, is very similar to what's in interfacing that's used frequently in fabrics. You know, collar stiffeners are made of that material, and it's used as a lining. So in and of itself, probably not effective, but if you were to layer that in between a couple of layers of another type of fabric. So folks have looked at it is that you have a balance between breathability, so in other words, something that's comfortable but also effective. So I'll give you a for instance. Vacuum cleaner bags were noted to have very, very tight pressed fiber, which helps to trap most things. But if you can imagine walking around with a vacuum cleaner bag over your face or having that material, it does increase the work of breathing. And so if you have underlying lung disease, or just if you've got to wear the thing for 7 or 8 hours at a time. Beyond that, it seems that tightly woven cotton, as you might find in a cotton t-shirt, or maybe in a dish towel, that has a fairly tight weave, and relative to an N95 will trap anywhere from 40 to 60% of the virus particles or what's flying around. A surgical mask may be 80 to 85%. And then it sort of drops off from there into other types of fabrics. So this past week, what you saw is this Center for Disease Control actually went from recommending masks for those who have an infection so that they stop the spread to others. And that's still valid. I think they did it for two reasons. One is there's a lot of folks who may not be having symptoms, who may be shedding virus. And there may be some who, with the seasonal allergies that are so prevalent right now, it is impossible to tell which one of those folks may have COVID or just has allergies. And it's vexing for clinicians who are trying to be a good steward of the testing material as to how many of those folks to test. So the current recommendations are, if you're going to be outside, wear a mask. And there's a whole lineup on the CDC website of easy to make masks, those that don't require any sewing. All it requires is a couple of hair ties or rubber bands and maybe a bandana. There's a short video of our Surgeon General making one right online on the CDC website, which is kind of entertaining. And then beyond that, there are some simple to sew types of masks and patterns that are starting to really become very, very common and easily accessed. And then what I'll call maybe a more sophisticated mask, which could potentially be made out of a layer of, say, cotton weave with an interfacing layer to provide a little bit better effectiveness. So there's a couple of hospitals across the nation that have put out a plea and are sometimes providing raw materials for surgical masks to be made. Of note, Providence Hospital and Deaconess Hospital both have websites that are pretty well fitted with videos and links to tutorials to help for those who want to help within their community, or if your local hospital is starting to run short to help make masks. Providence Hospital called their initiative 100 million masks, and it seems to have taken off. People are really diving in for them.
And you're right. There's a shortage of masks all across the land, and you said a couple of good and important things. that I want to bring back to the viewers, especially the viewers just tuning in, like Kathy, Kendall, Lisa, Jay, Lisa. There's a couple Lisas on. So thank you guys for tuning in to 2 Cents Tuesdays. This is the 2 Cents Tuesday broadcast at 1 p.m. with your host, Dr. Jarret, which is me. We are speaking with Dr. Bob Motley, the Vice Chair of Community Medicine at Jefferson Health. And we are talking about masks in particular. And so we know there's a shortage of official surgical masks, N95 masks, the typical hospital grade equipment, and people are running out in the hospitals. However, at the same time, the CDC is recommending to all of us to wear some sort of mask while you're going out. And Dr. Motley just walked us through. And remember, it's to help stop the spread from each other, because particularly as allergy season is in full bloom in many areas of the country right now, people are going to be coughing and sneezing unrelated to COVID or coronavirus infection. And there's really no way of telling if you are infected, especially if you're feeling well. And you may also not just be sneezing out some droplets because of your allergens, but you may be spreading the virus as well. And so this is one of the points that Dr. Motley is very certain about. And as we talk about, we aren't able to always have these kind of masks around, but you can also make masks out of bandanas as a facial covering. We've also seen them being made out of t-shirts and t-shirt material as well. So you can have all of those. I wouldn't use this particular t-shirt for your mask, just in case you have one of these laying around. But a old raggedy t-shirt would be okay, perhaps to cut and make into a mask for yourself. So it's good to know that there are several things out there. And Dr. Motley has done an extensive amount of research on this subject, and even has a resource that we're going to share here in just a moment. In fact, why don't we share one of the resources that you have created right now, Dr. Motley, and I will bring this up on our screen so that everyone can see what's going on. But as the originator of this document, Dr. Motley, I would love for you to kind of walk us through a little bit about what's going on. As I welcome the next person up is Carla. Thanks for tuning in to 2 Cents Tuesday here. We are broadcasting live every Tuesday at 1 p.m. Facebook Live. All you have to do is follow me or like me at Dr. Jarret. Spell out the word doctor, J-A, 2 R's, E, 1 T. We are here with Dr. Bob Motley, Vice Chairman of Community Medicine at Jefferson Health. And we are talking masks and what you should do with masks and about masks during this epidemic. So now I have up on the screen for our viewers, Dr. Motley, a very good document. And we are going to make this document available so that you too can be able to have this information at home. This is just so fresh off the presses. We didn't even have time to collate it for you, as Dr. Motley will let us know other things that he's up to. But let's talk about this document, because I think this is a great document about masks. Take it away.
Okay, so I just want to say thanks. The graphic you're seeing there is produced by the Pennsylvania Department of Health just this past weekend, and really just try to break it down in terms of what are the 3 basic types of masks and who are the folks that they're really designed to be used for. If I had to sum it up, and have it there in the middle of the page, the bottom line is, using any mask as a barrier is better than having any barrier. For somebody who is shedding virus with the level of contagion that we're seeing with coronavirus, having a head covering makes sense. So what are the settings where this makes sense? Certainly anytime you have to go out of your home, just running to the store, my hope is that you're being really judicious as you choose how often and where to go out, and trying to reserve that for necessities. Maybe even making lists so that you don't find yourself going out multiple times a week. Again, there's trade-offs, I think, between effectiveness which has to do with the mask design as well as the type of material used. The harder to come by surgical mask material, is typically sold by medical and surgical supply companies. It's sometimes used in surgical drape. Again, most of that's being directed toward the healthcare system. So behind that, we have a number of things: coffee filters, vacuum cleaner bags, all of which could be trimmed and laid in as an interfacing for a mask that would otherwise be made out of cloth. And then among the cloth options, probably 100% cotton, that which you might find in a bandana or a t-shirt. Again, 2 layers, usually a front and a back layer, that then are fitted so that it's actually covering the nose, covering the chin, and not leaving a gap along the cheeks. Most people are attaching these with elastic bands. Some are sewing strings that can be tied around the back of the head. Whatever design you choose is going to be a matter of what you have at hand. So if you don't know how to sew and all you got are the basic ingredients, there's links on this document to videos, including one on the CDC website that'll show you how to make a simple mask, simply folding over a bandana or handkerchief or t-shirt, and then attaching a couple of hair ties, folding them, and being able to then don the mask. If you have a t-shirt and a pair of scissors, there's a simple outline here for cutting that t-shirt such that you'd have the mask in the front, you'd have room to put a couple of layers of interfacing of your choosing, and then enough string to be able to tie it on. I want to say just a word about taking off and putting on your mask, as well as how to store your mask. You should be careful after you've been wearing it. Obviously, if you have a cold or if you have allergies, it's likely the interior surface of the mask is going to get soiled with vapor. We want that to dry out, and that's not what you want to touch. So the rule of thumb is to always wash your hands thoroughly with soap and water before you put your mask on. And then when you take the mask off, if you can avoid touching the inside of the mask and handling it carefully. I'll also say that, if you are in proximity to other people and there's a possibility the exterior of it could be a little soiled. So the cloth ones are washable. Probably using just detergent and water. You want to avoid chlorinated solvents or alcohol preparations. And you want to handle the mask carefully, taking it off without touching the main component of that. And you can put that in to rinse it or wash it. So if you have a couple of these available, you can alternate each day. For people who have surgical masks or other types of masks, there are meant to be reused. You can carefully remove them, store them in a paper bag, and put them in a clean, dry place within your home, so that the moisture that happens to be in the mask will have a chance to dry out. So on the reverse of the document that Dr. Jarret has shown you, there are some very good, somewhat entertaining YouTube videos. If you want to go all out and want to help others and you know how to sew and have access to a sewing machine, there are a couple of projects being run by hospitals as well as some local hospital agencies in your community. You could certainly check with them to see if they have a mask making operation from a volunteer staff for those hospitals that may run into shortages.
Yes, and absolutely right. Thank you for that, Dr. Motley, because a lot of folks really are at the point where I've got to do something myself. I've been to the hardware stores, I've been to the drug stores, I've tried to order masks online and they've never come. And we're now being encouraged to do some things. So remember that we're trying to protect each other as well as protecting ourselves. And that water vapor and things that are coming out of your mouth when you cough and you breathe will be on the inside of that mask. So again, when you're taking that off, you don't want to have that where people, and especially your kids, are going to be touching that and doing a lot of things on it. And of course, we've been talking good hand hygiene from the beginning. And you can go back several episodes to catch our hand washing episode. I would also like to welcome Joanne, Dr. Hodan, Emmett as well for all tuning in to Two Cents Tuesday. They are joining us live on Facebook at Dr. Jarret. We are talking with the Vice Chair of Community Medicine at Jefferson Health, Dr. Bob Motley. We are talking about masks and mask making during this COVID epidemic. And as we are about to wrap up this show, Dr. Motley, I understand that you have been trying, and your wife and a number of others have been trying to help personally with the mask shortage that many healthcare workers are having right now. Could you tell us a little bit about that?
Yeah, I got involved early on in terms of being curious about how we're going to prevent spread. And even at a community level, we've been working with some community organizations through sort of email chains and phone call chains to folks who are closer to the front lines. When that message comes out on TV, we're almost on information overload. So some people have tuned out. And I think that message is not reaching everybody in the deep portions of our community. So there have been some folks who have been really wonderful at being willing to take clear, action-oriented messaging and taking it and distributing it through various channels so we can get it deeper into the community. As we were doing this work, my wife and I sort of began to really realize that masks were probably going to be needed. And in fact, surgical masks were likely to be in short supply. And that's kind of proven true. We were fortunate. We did a little nosing around of what surgical masks are made out of. And I was actually able to find a medical veterinary supply company at the time that had rolls of this material available at a very reasonable price. So we made a purchase. It's interesting, I shared that information with one of my colleagues who posted on Facebook, and they were totally sold out of that material within another 3 days. But with that bolt of material and the volunteer cadre of folks that we have, we get about 15, 16 sewers. We've made about 700 masks over the last 2 weeks, and finding out that a lot of our local nursing facilities and their staff, sort of in that hierarchy of need, are standing behind outpatient centers and hospitals. So they were very grateful to have their certified nurse assistants and their nurses be able to have masks while they're caring for patients. We even got a call from one of my daughter's friends who's a nurse at a local hospital that was being slammed with patients suffering from COVID, and we're starting to run short of their PPE even though it's been on order. And so 100 masks went up to those folks. And again, everybody has their little way that they can contribute. This is, I wouldn't say it's anything that special. We're seeing a lot of people keeping our shut-ins company by giving them a phone call, sending letters of encouragement. I'd love to point people toward hashtag 19 Letters of Hope, which is another initiative started by a healthcare worker to encourage our frontline responders, sending a note to teachers who are working extra hard these days. Pick a half a dozen people in your life that you could reach out and just connect with and provide encouragement during this time. So everybody can do something. Everybody can make a mask. Everybody should wear a mask.
And you heard it from Dr. Motley here first on Two Cents Tuesdays, the official Who's Badass Kids of those podcasts. Everyone should wear a mask. And I certainly would like to thank both Dave and Ben for bringing up this as a good subject matter question. We certainly have more clarity around this, and we wanted to bring an expert right to the show to talk about this. Not only does he know a lot about a mask, not as he knows a lot about community and medicine in general, but he's actually making himself a part of the solution by designing and having some masks that are wearable for people both in healthcare and outside of healthcare, which is wonderful. So we are encouraging all of you guys to continue to be safe, practice good social distancing, and of course, now when you're out in public, put on that mask. And in fact, when you go out in public, probably just keep it limited. If you don't have to take the kids, don't take the kids. Just take it step by step. Make sure you're getting yourself out there. Dr. Motley, thank you so much for having on the program. We're getting lots of thanks for you for coming on and sharing your information on Facebook with us. And as usual, shout out. We have another Emmett on here. Lisa's thanking for the information. Dr. Holden is saying everybody can do something. Make a mask and wear a mask. They're saying exactly what Dr. Motley is saying here. Thanking you for your appreciation. Is there somewhere that people can find out more out about you or, and contact you at Jefferson for some more information, Bob?
So I work in the Department of Family and Community Medicine at Thomas Jefferson University. We're located in Center City, Philadelphia, and affiliated with Sidney Kimmel Medical College. So we do have an office there. I don't have an email off the top of my head, but certainly folks would be welcome to make an inquiry if they had a public or community health question. I'd also like to highlight our city's Department of Public Health. They are working on all cylinders, and all of you, regardless of your community, at the county level, and if not, they're your local hospital. They're frequently sources of really good information that can help to guide you. And if you have clarifying questions, your personal physicians right now are probably all over the map and trying to adapt to doing online visits, but many of them are making themselves extra available for people who have questions through their patient portals. So there's lots of places to get good information from a reliable source, and I would encourage you to do that.
Absolutely. Thank you so much for being on the show this week, Dr. Bob Motley. We'll definitely have you back in the future as another guest. You have such a worldly wealth of information to share with people that was much appreciated today. Thank you guys all for tuning in on Facebook today. And as you know, the best way to get updates on this show is to simply like the page. So like the Dr. Jarret page anytime I go live. And those of you that know, I may be live on stage broadcasting. I may be live in my car, maybe live in the airport, but anytime I go live, you will get the notification. Simply like the Dr. Jarret button on here. And then, if nothing else, tune into 2 Cents Tuesdays every Tuesday at 1 Eastern. I am Dr. Jarret, your board certified pediatrician, and we have Dr. Motley on the other side. He is our guest today. He's a board certified family medicine physician. We have been talking masks about and the COVID pandemic. We hope that you guys all continue to stay safe and do well and be blessed. Thank you guys for tuning in, and we will see you guys next time.